as a company at Hill & Marks, our focus right now is to get as much information, as much visibility, as much transparency as we can into what's going on, to help support you and to allow you to do the best you can to prevent any kind of spread in your businesses, your organizations, your healthcare facilities. And we brought together a really talented, smart, experienced group of people in the industry, in the public health space, in the cleaning and disinfection space, and then understanding the supply chain from our perspective. So Jim Harris, president of Janitronics, we're very honored and lucky to have him as a part of this panel. He'll start from as the moderator, introduce himself, and then each person in the panel will introduce themselves, and then we'll have time for questions from Jim, and then for the last 15 minutes or so, we'll be able to take questions from the audience. So again, thank you everybody for joining us, and we hope you enjoy and get as much as you can out of this.
Good morning, everybody. Jim Harris Jr. I'm the president of Janitronics. We're a building service contractor. We run the Maids as our residential brand, and Janitronics is our commercial brand, and we service facilities from Hudson Valley to Buffalo, pretty much all of upstate New York, and into Burlington. Some of our current clients are extremely essential. We're doing the work for the Wadsworth Labs. We're doing the National Grid sites, and Regeneron is working on the remedy for the COVID-19. So we have about 25% of our workers and customers have ceased operations. So we're helping our partners out with that, and our employees. Our maid service was deemed unessential by the Attorney General last Thursday, although the ruling does have us as essential. So we're trying to fight through that situation. So we've got a lot of expertise in cleaning. We currently have 18 crews on the road that are in vans and PPE that are cleaning confirmed cases for sites, commercial sites only, and including vehicles and offices and all different types of facilities. So most of our customers have increased cleaning at this point in time, and some have just shut down. So we've got kind of the gambit on all that activity. So I'll be around in the end for questions, and I'll turn it over to the next panelist.
Hi, I'm Jason Packer. I'm again the CEO of Hill & Marks. We are a janitorial and food service distributor based in Amsterdam, New York. We distribute as far west as Buffalo and as far north as the Canadian border, and south towards Elmira, Poughkeepsie, down to the Tappan Zee Bridge and into Elmira and Binghamton. Our focus has always been disinfection and sanitation for our customers, from healthcare to gyms to K through 12 and restaurants. And we're finding right now that this is becoming a more important place for us to play and support the community. So our expertise and what we can do to provide everybody information, this is why we're having this panel. You know, I joined the company. This is a family business. I joined about 10 years ago, and this is by far, you know, the most unusual time I've had in this company. And you know, our job is to get everybody product. We're working very hard on that. Obviously, you know that there's a shortage of hand sanitizer, disinfectant products, and for whatever reason, toilet paper. The economists and psychologists will figure that out one day and report back to us. But we're doing our best, working really hard to get those products, importing products from China, and working with domestic partners to get the products in. So we again thank you for joining this panel, and I hope you get a lot out of it.
So I think Jason covered quite a bit about Hill and Marks and the background and the efforts that Hill and Marks is putting forth during this pandemic. But just to tell everybody about myself, I'm Joe Waite. I'm the Vice President of Sales at Hill and Marks. I've been with the company just about 3.5 years now, but I've been in the industry 20. Prior to joining Hill and Marks, I've primarily worked with chemical manufacturers, and I've worked both on the distribution side and also on the manufacturing side. So welcome everybody to the call. Hopefully we'll be able to answer a lot of your questions today and provide you with some good information. Be safe, and look forward to this call. So thanks everybody.
Good morning, everyone. First, I want to thank Jason and his team for having us all here and putting this together and kind of corralling all of us. My name's Dana Manisha. I am the director of the undergraduate public health program at the Sage Colleges. I heard Jim mention the Wadsworth Labs and had a warm fuzzy in my heart because that's where I started my professional career as a technician. I am also the director of the graduate programs in the School of Management. And my area of expertise is really in behavior change and why people do what they do. So Jim, I don't have an answer yet for you about the toilet paper, or Jason, but I will come up with one hopefully someday.
Morning, everyone. Thank you very much for this excellent opportunity to partner with Hill and Marks. I'm Cathy Kelly. I'm Dean of the School of Health Sciences at Russell Sage. We're a small liberal arts college with a little under 3,000 students. The School of Health Sciences has 6 programs: nursing, nutrition, OT, PT, psych, and forensic mental health. And needless to say, in the last few weeks, our students and faculty have been inundated with transitioning to online education and being asked to be involved in a lot of panels and webinars such as this. My experience prior to joining Sage, I was a nurse practitioner in clinical practice in internal and preventive medicine in the Capital District for many years. I then went back and got a master's in public health at UAlbany and a PhD in public administration and policy from Rockefeller College. I've been at Sage for 10 years, and I also have oversight for the Doctor of Nursing Science program there. I look forward to the discussion today, and thank you for the invitation to be part of this excellent panel.
Good morning, everyone. My name is Ruth Patron. I work for Ecolab, a Minnesota-based company, but we have reached to 170 plus countries around the world, primarily in the hygiene and sanitation space, but our business is broad and we reach to the energy sector, food service, building services, food manufacturing, water treatment, and so on. And really, the Ecolab's goal is to protect people and our vital resources. My role is the senior corporate scientist related to food safety and public health, charged with essentially keeping up to date on the newest emerging trends and threats and so on, and helping Ecolab be ready to understand those and better service our customers. I actually started my life in New York. I have a bachelor's degree from Cornell University in consumer food science, and then moved west and have been in the Minneapolis area for the past 35 years almost. Along the way, I got a master's in food science and then PhD in public health. Have worked for multinational food companies and have been at Ecolab for more than 13 years in this technical leadership kind of role for these past years. Related to COVID-19, it certainly is my 24/7 activity these days in trying to interpret what our public health authorities and officials are saying, but more so trying to translate this down into what that means for many of our daily lives. And I'm happy to be here, and thanks also to Hill and Marks for having me as part of this.
Okay, so what we're going to do, the process here is we're going to go through, we've got a series of questions we're going to ask the panelists. I'll ask the panelists by name, and then they can answer it, and then anyone on the panel can feel free to join in. And then at about 30 minutes from now to 40 minutes from now, we'll have a Q&A from all the viewers. So Ruth, we're going to start with you. What different kinds of disinfectants can be effectively used against the COVID-19?
Well, the good news is that there are many, but we had some challenges at the beginning because when we have an outbreak of a new virus like that causing COVID-19, there are not any products that are on the market that have claims against such an illness agent simply because it's new. What we are required to do is demonstrate efficacy against the types of organisms that we want to claim effectiveness against. So as we don't have the virus available to test because, again, it was new. But the good news is that many countries, certainly including the US, have what's called a hierarchy-based approach. That means if a product has been found to kill a so-called harder to kill kind of organism based on the structure and function of that organism, it's deemed effective against an easier to kill virus like that causing COVID-19. And a piece of good news about this illness agent is that it's a so-called enveloped virus, and that relates to its structure. And that means essentially that it's easier to kill. So we can make use of this hierarchical approach from EPA and others to come up with quite a list of products. The EPA has made this list available here in the US in a list called the so-called N as in Nancy list. And one can go on that and search for the dozens and dozens of products that are there to find one that would be acceptable. It's best to search by the EPA registration number, which is found on every single registered product in the US. It's required by law to have that. So searching by the first sets of digits of that number will allow you to verify that the product you may have in your facility is indeed acceptable for use against COVID-19.
If I can just add to that, Ruth, I think it's very important to understand that there are a large variety of different disinfectants, whether it be sprays or wipes, electrostatic machines, whatever it may be. A number of those products have been identified, but I think it's important that everybody on this line, from a customer perspective, from an employee perspective, they need to understand how the product is supposed to be used, and if there are certain pieces of PPE that are required to use with those products. Some of them, they may be hand mixing these products, so it's important to understand what the proper dilution ratios are, as well as dwell times, because above everything else, it's our obligation to make sure that everybody is staying safe when they're using these products, and I think it's important that everybody's aware of that.
Yeah, great point. Following the labeled directions is key with these and making sure they're used in areas that are appropriate. Some products can be used very broadly. Some are restricted or should only be limited to, say, use on food contact sites and so on, and that's important.
Hello.
I'm sorry, can you hear me now?
Yeah, your mic was on.
Okay. So the question is for Ruth, how long does COVID-19 survive on surfaces?
Well, that is a question I have answered lots and lots of times, and the challenge is, again, it's a new virus. We have relatively little data, but there was one study completed and published in the last about 2 weeks that actually did work with the virus itself. What they found is that they were able to recover the genetic material from the virus for about as long as 3 days on stainless steel surfaces, a little bit shorter than that on plastic surfaces, and for about a day on cardboard surfaces. And we've all probably seen those data quoted. One thing to keep in mind, though, is that the way we test for presence of a virus under the current methodologies available to us are by looking for the genetic material, or the RNA, which is the powerhouse of a virus. So what they detected was basically remnants of RNA that were left behind by the virus. Well, these data don't tell us, and it's again an evolving situation, is whether those viral particles were infectious or not. So while we have some data indicating a couple days of survival, we really don't have a good sense of what that means from a transmission standpoint. Yes, I think we can all imagine that it is theoretically possible for transmission of the virus causing COVID-19 from a surface to a person. For example, if someone sneezes on a surface and there is a wet droplet, if someone else comes along and touches that droplet, if it contains infectious viral particles, and then touches their own eyes or nose, for example, there is a potential for someone to infect themselves from that surface and from that droplet. But if we just think practically about the likelihood of that happening, imagine a small droplet that's going to evaporate quickly. We can't say it's a zero possibility, but I do believe it's remote. That said, this assumes that we are following all the practices we're supposed to be following. That is, not being out in public and around others when we're showing symptoms, making sure we're washing our hands very, very well, and using hand sanitizer if soap and water are not available, and performing routine cleaning and disinfection of high-touch surfaces that could be contaminated. We also don't have any epidemiology indicating that transmissibility from a surface has led to an illness, but rather it's generally close contact, that is within 6 feet for several minutes, with someone who is actively showing symptoms. Certainly are the majority of the illnesses. And we can get into how we're seeing some other ways of transmission, but so that's a very long answer to the how long does it survive on surfaces. We have some base data, but we have to make sure that we interpret it very, very carefully.
Okay, thank you. So the next question is for Kathleen regarding the wearing of a face mask.
Thank you. So originally, the World Health Organization and the CDC had recommended that the general public not wear face masks. I'm sure that most of you have seen the news in the last 24 hours that's really rethinking that policy. Last night, Dr. Bricks was on as part of the presidential task force talking about it, and the Surgeon General, Dr. Adams, was on television this morning indicating that CDC is really rethinking that policy. And I would echo what Ruth is saying. This is a new virus. We are learning aspects of it on a daily basis. And one of the things that we have learned with recent research studies is that people may be asymptomatic for a few days before they become ill, but still able to shed the virus. And they found in one study in China, as many as 25% of people were infected with COVID and asymptomatic. So this is leading researchers to rethink, is there merit to using masks for all of us? The problem, as everyone well knows, is the shortage, and certainly we don't want the general public wearing N95 masks at the expense of frontline healthcare workers not being able to use them when they really need them. So I do suspect in the next few days, not sooner, maybe a change in this policy. And I think individuals really need to decide for themselves, does putting a bandana on when you go out and go to the store, I don't think there's any harm in doing that. And the science may show that, in fact, that may be helpful in stopping the spread of COVID-19.
I'm sure that some clerks in some stores do not want to see someone walking in with a bandana on their face, but if it helps, if it's for the purpose of not spreading germs, I'm sure it's fine. Because as the economy turns, guess what happens again? Crime goes up. Ruth, do you have any other comments on the face mask?
No, I think Cathy covered it well. But the thing I would keep in mind is that, you know, if and when the recommendation changes from CDC, and I agree, I think we will see some more on this soon. We can't forget about all the other practices we're supposed to be following, like maintaining a distance between each of us. Basically, because of the biology of this virus, it just simply because it's a decently large kind of particle, it just settles out pretty quickly and doesn't travel over long spaces. So I'm not saying that there's not value in perhaps wearing a mask out in public, but we also need to continue to maintain our 6-foot distance from other people. And if we are showing any symptoms, to absolutely not be out in public where we potentially could infect someone else. So it still has to be a very collaborative kind of effort by everyone to practice all of these procedures.
Okay, thank you.
Jim,
shift a little bit to, go ahead.
Sorry, just regarding masks, this is Jason. Is there a specific mask that, I mean, the N95 seems to be the mask everybody's talking about, specifically regarding healthcare professionals. But for the general public, does it differ? I mean, are surgical masks, you know, okay, or is that just not going to be enough protection? Is there enough evidence? Obviously, there's not a lot of evidence, but you know, should somebody be, you know, leaning one way or the other?
I think the answer to that question will unfold, but originally this was thought to be just a respiratory droplet. So in other words, if someone coughed, sneezed, that's how it was spread. There's now some newer research suggesting that it can be aerosolized, which means it can stay in the air for a period of time. So that's also another reason for people to consider using those. I know some people have started using like the contractor type masks, but the most important point is this is only one piece of the plan for all of us to reduce the incidence and the transmission of this disease.
And I think another important point is that we absolutely need to make sure that our frontline healthcare workers are equipped with what they need to allow them to continue doing their great work. If we have severe shortages of healthcare workers, we're even in a more world of hurt than we are right now. So we have to reserve N95s for healthcare workers, absolutely. That is the best kind of mask, and we need to make sure those are funneled to those folks. Surgical masks provide a lesser degree of protection, and I would argue that those still should be funneled more so to healthcare workers or people who are sick who might need to be out in public, like they need to go into a healthcare facility to prevent their active transmission. As Cathy said, I think we will hear more guidance from CDC on the kinds of masks / face coverings, et cetera, that could be helpful.
And I think this is an interesting policy decision because we know that there are not enough masks for the frontline workers now, which desperately need them the most. Yet if new science is suggesting that all of us wearing it could potentially spread the transmission, then that's where I think the business communities come in and ramp up the production. of whatever is deemed appropriate for the general public.
Okay, thank you. So we're going to shift a little bit to how businesses are responding to the COVID-19 pandemic. So we're going to lead off with Jason and Helen Marks' strategy on that, and then followed by Dana.
Thanks, Jim. So when we first heard about the outbreak in the United States, our company, and just we started with our best practices, moving to get all of our employees out of the building, just like many of you, and started with our administrative staff working on remote technology. We're working with with a company on a soft phone to allow our customer service team to work from home. That'll be fully implemented in the next few days. That's taken several weeks to get into place. In our warehouse and our transportation team, we've done a lot in terms of keeping them safe, sanitation of their equipment, wiping down equipment every hour. We've had to move our deliveries to just drop off only, so as not to mix our team with other folks, to keep everybody safe. And we're always looking for new ideas. We believe we've been able to find some face masks and face shields that we're going to be providing to healthcare facilities first, and then use for our team that are customer facing, to protect them, so we can continue to provide products to healthcare facilities without any interruption. So continuity, we believe business continuity is very important to keep the supply chain moving. And then the other thing we're doing is there is a shortage on Clorox wipes. There's a shortage on Purell hand sanitizer, and every kind of hand sanitizer, every kind of disinfectant. There's a shortage. There will be a shortage on gloves coming shortly. There's obviously a shortage on masks. So our job as a distributor and as a company is to source as best we can. So we're spending hours around the clock finding alternative sources of product, and we've been fairly successful in doing that. But we believe the supply chain will be interrupted for several months, if not longer. And that's part of our plan to support the community, is just to continue to find other avenues.
And Jay, just to add to that, I think part of our strategy too is in addition to supporting the community. I mean, obviously, we have corporate obligations, but I think we also have.
Do you want to do one of your worksheets for school?
As a family-owned business, we've developed years of relationships with our.
Somebody is actually, if they could mute. There's some people that may not be muted. If you could, we can hear you. There we go.
Can you hear me now? So,
yes.
Okay. So all I wanted to add to that was, our efforts in making sure that our customers are educated, our customers, but also our community. A lot of times our community members are customers of Hill & Marks. So what I mean by educating is making sure that they understand what COVID-19 is. They understand the things that they can do to prevent it. They understand, what's going on in the market today. I mean, this thing changes daily, and it's our jobs as sales professionals at Hill & Marks to make sure that our customers are educated on this. So to the extent that we can be as transparent as we possibly can and make people aware of allocation issues with whatever it may be, so that they're prepared and searching for alternative solutions for them to be more prepared. It's not exclusive to disinfectants, right? I mean, we're now seeing that the food service industry is taking a big hit, and the food service customers are a large part of our business. So trying to work with them and develop different strategies and different ways that they can stay open and better serve their customers in the communities is definitely something on the forefront of our minds.
Can I just ask a quick follow-up question here before we move to Dana? Jason, you referred to the months ahead. You perceive some shortages. Wouldn't that promote more of the problem we're having now with hoarding and people ordering 10, 12, 15 times their normal amount to make sure they don't run out? And are you guys doing anything to manage that so people are not hoarding and creating a worse problem than might exist?
Absolutely, it's a good question, Jim. We do. Joe actually and his team spend a lot of time allocating products to customers and ensuring that aside from healthcare, because healthcare I believe is increasing and ramping up their usage in many cases, but in most cases, yeah, we're trying to allocate equal to what they were purchasing in the past. And trying to red flag any issues and trying to communicate to our customers that, you know, we still do have product, and we are going to continue to get product, but the shortages, to your point, Jim, are due to a panic. There is enough product in the pipeline, and it's just going to take some time for it to clean up. I mean, schools are closed, restaurants are closed. And many organizations have closed their buildings. So that says to me that you know, if people are ordering too much, that they are panic buying. So we are trying to have that discussion with our customers, just like I'm sure you are, Jim. And maybe you can answer that even better than we can. You're very close to those end users.
Yeah, we've had customers request 15, 18 times supplies. Because they're deemed essential. We started rationing in February because we already saw the slowdown happening and the requests coming in. So that's been our concern from the beginning, is that, you know, the supply chain, can it go 2x? No, and when it's running 8, 9x, it's going to break. So there's going to be people that run out, and then if you don't hoard and the others do, then you're left out. So it just creates this momentum, and a lot of it's driven by the ease of information now, social media and some of the media that's creating all these things. And when someone figures the toilet paper rush out, you know, that'll be the story I don't think there'll ever be an answer to that. So, all right, Dana, do you have any comments on this?
I think a lot of what you guys have said makes sense. We are seeing that, you know, the hoarding, it's a fear. So keeping the communication open and letting people know as much as we know at this point is crucial. I think businesses can best respond by, you know, being flexible. Jason and Joe spoke about how they've changed operations and, you know, continuing with the best practices we know at this point to keep the transmission down. And, you know, Cathy and Ruth mentioned how things are changing constantly. So we really all need to keep up to date. But yet for our employees and our customers and those we deal with, distill that information the best we can, because it does become overwhelming. You know, you live it, you breathe it. There's so much information coming at us from so many different directions that really being able to understand some of it and have it distilled for the customers, for the employees, will help with the response. And that communication that says, we have enough coming down the pipe, please don't hoard it, because that means somebody else can't have it. So I think the flexibility, the open lines of communication, and really just helping people adapt to that new normal, which is changing daily.
Yeah, and the manufacturers are trying to keep up, and if they like a company like Gojo, who's going to buy Perel in the fourth quarter when they bought Perel for the next 5 years, right? So they're going to have some business challenges next year unless it continues. Kathleen, did you have any comments to join in on business response to COVID?
I actually do. In academia, our commodity is faculty, staff, and students. So one of the things that SAGE is doing is we have a new initiative called SAGE Thrive. And we're trying to respond to the fitness needs of faculty when they've transitioned from being very active to being much more sedentary and going from one Zoom meeting to the next. So we actually have faculty and staff that are have volunteered to do like yoga, karate, abdominal, guided meditation classes. We have a nurse practitioner in the wellness center that's doing daily videos on mindfulness and relaxation. So while in manufacturing you may have a product, we are trying to focus on the mental health needs of our faculty, staff, and students as part of this initiative. And this is only one small piece of it. But our goal in the fall will be to infuse health and wellness across the curriculum. So even though our target for rolling this program out was the fall, opportunity happened and we decided to move in this direction. Today will be the first time faculty will be able to engage at noon.
Okay, thank you. Next question, what are the best methods for preventing the transmission of COVID-19 among employees? Dana, you had some thoughts here?
Well,
Yep, thank you. We know what to do, at least at the moment. The 6-foot distance, the washing the hands. I think the best thing that we can do for our employees is to remind them, because we get into a routine, we may forget. So a lot of that, point of decision making, reminding when somebody's walking out the door, remind them, did you wash your hands? Change your clothes when you get home. Discuss the reminders that are out there. Translate that information, again, down to a tangible, easy to understand, easy to digest message for people. So really keep the information out there, keep it up to date, and check in with people also, because part of the transmission is staying away from people. And if we're seeing the stress from being isolated and being at home, people are going to start, unfortunately, reaching out to others and physically getting closer. So trying to make some of those connections from afar so we don't see people do that in the transmission. But again, with the employees, it really is stay up to date on the information the best we can and keep reminding people and getting the information out there, because we're humans, we forget, and under stress, we forget even more.
Jason, any comments from your side?
Yeah, I would agree. We're spending a lot of time having a weekly, or I'm sorry, a daily leadership meeting to go through any things that change, which they do change on an hourly basis. And then we also are asking our managers to have a daily check-in. We're actually now moving that to twice a day to make sure everybody is informed and feeling comfortable and feeling a part of what we're doing, and also feeling morale, having connection, having human connection. We want to make sure we have a lot of employees working from home now. We want to make sure that they're connected with the organization and feeling connected. We're also doing fun. We're trying to do some fun things like on Friday we're going to have a meeting, a whole company meeting, and have a crazy hat day if people are able to be able to be seen on a video. And just different prizes and things during that call. We're trying to keep that camaraderie together, because that's what we've been really good at in the past, and now we're just trying to adjust that for the today, for the new reality we have right now. And then also engaging. People really feel good, and we feel good, and we want to do that. We're engaging more in the community. We've donated a pallet of food to the food bank for their distribution. We have a new Tuesday takeout program, so we'll have for our customers, our food service customers, we're going to get gift cards and then raffle them off through Facebook. So just continue to get our customers. Have people interested in buying food at their organization. So just keeping things as much, this is a serious situation, and everybody is slightly on edge, or more than slightly on edge in some instances. So keeping it light and enjoyable and communicative and human as possible, that's really important to our organization.
Thank you.
So, Jim, just real quick, I just want to tag on that too. I mean, everything that we're talking about here in terms of preventative measures, I mean, I like to think that Hill and Marks, we were really proactive in getting ahead of this, and we put a lot of different steps and procedures that are becoming the normal in today's society that we see, the social distancing, people working from home, things of that. In reference to things that we're doing to help prevent the spread of COVID-19, as a sales organization, we have trucks going to our customers on a regular basis. And I think one of the things that we've done is put specific measures for warehouse as well as with our drivers, to make sure that anything that's going to our customers' facilities is safe. And what I mean by that is our trucks are regularly sprayed down, our drivers are wearing gloves, they have face masks. Any returned items that we were receiving were being sprayed down with disinfectants to make sure that it didn't spread throughout the warehouse if there was in fact anything potentially hazardous there. So I think it's equally important to understand that we're not only doing this stuff for our employees, but we're keeping in mind that, you know, as we're going in and out of customers' facilities, we need to be respectful of that as well.
And to Joe's point about the new things that they're doing and the additional work, that shows a sign of flexibility. And I think we need that in a time like this to keep people safe. And some of that flexibility is realizing that timelines may be different now. It may take longer to get a truck out if you have to clean it or do more, you know, procedures. So having that flexibility is crucial to keep people safe, because we have additional steps now that we need to go through to make sure we're safe and we're not transmitting the illness.
Okay, next is just on some of the employees. So a lot of our employees that are could be remote, that are not, they might be customer facing, but not necessarily person to person, and don't need to be in the office. So a lot of companies have moved to that. Kathleen, can you address the social isolation that's going on right now, both with people laid off and then people that are working from home?
Absolutely. I think this and the mental health implications associated with COVID-19 are going to become increasingly important on a weekly basis. And I think there's definitely going to be long-term ramifications of the social isolation. Some of the things we've started doing at SAGE is engaging a lot of our support staff that may have been used to interacting with a multitude of people during the day to invite them to various Zoom meetings. To still continue to feel part of the team. People have talked about daily leadership meetings and weekly check-ins with your staff and your coworkers. I know one of the departments has started with the joke of the day to all the colleagues, and they end with an inspiration of the day. And they've gotten students involved in this. And the feedback has been very favorable. Some of the inspirations have a spiritual connotation to them, and others may not, but it just gives people a reflection and a way to sort of start to de-stress at the end of the day. I've also recently been invited to be on the board of Community Caregivers, which is an organization that supports a lot of people in need in the Capital District. And we are doing daily phone calls, 2 calls a week to an individual to check in and what do you need? Are you able to get your groceries? Are you able to get your medicines? So I think there's a variety of ways that people can be creative in addressing and trying to minimize the social isolation as much as possible.
Dana, any thoughts?
Well, my thoughts are people have given some really great examples. Joe and Jason spoke about what they're doing. Kathy spoke about what we're doing. And I think we need to give people permission to engage socially. And there needs to be that when you're in the office, you may walk down the hall to the printer and run into somebody and stop and say hello. I think it's crucial that people continue that, even if they make the effort to call a coworker and just say hello for a few minutes. You know, give them some of that time to be socialized and give them the permission, because it seems to be there's a feeling that you're at that computer and you're sitting there and you're staring at it and you're working, and we're trying to be as productive at home as we are when we're in the office, but we don't get some of those same breaks because we are isolated. So to address that, so we don't have a lot of mental health issues, or to minimize them, really have that culture shift so people realize you need to take the time to check in and, you know, have funny hat meetings, because it is going to make things a little lighter and more comfortable.
Jim, can you share some of the things you're doing with your organization? Because you've been at work and working 7 days a week, 24 hours a day. So you're in the weeds here.
Yeah, we're doing daily calls. We filmed some messages yesterday. We had our marketing company come in yesterday. We filmed some messages for internal and external communication. we have a series of very vital sites that we maintain. So keeping a check on mental health, really the stress of that is the key. We're constantly talking to people. We're sending out inspirational emails each day. There's good and bad to emails. You get I've gotten an email from every company I bought one thing from in the last 20 years. So, and I don't care that they're cleaning the plastic wrap, that there's certain things I'm not buying. So there's that, but it's really, we're using calmness, collection of data, and then we're communicating with people, and we're showing compassion, both with our partners and our employees. So that's really what we're focused on. We've got a lot of stressed out clients that, including a couple that I'm sure they're going to reopen. And as this goes on longer and longer, there's a lot of anxiety and a lot of unknown. You use the example of a hurricane or a tornado or some natural disaster. That's a regional event that other regions can help out with. But when you have a worldwide event like this, has never been anything. Well, it's happened before. It just hasn't happened in our lifetime. It's been 100 years since it's happened. So, and there's a lot of interesting data about the 2017 flu season, which was dramatic. 61,000 deaths and 30 million people. That just kind of gets blown under the radar. So I think confusion of information, so just trying to be clear, concise, and consistent is really what people need to hear, and they need to hear from the senior leadership. And I would imagine most senior leaders are stepping out right now and communicating with their teams at all different levels.
Jim, can I just follow up on that question too? What is your company doing to keep people, your customers, safe? How are you, what is your service to them right now?
So what we've done is we've, in some of the offices that have left staff in it, we're doing all touch point cleaning. We're doing detail areas. We're actually doing carpet cleaning and floor refinishing if we can get in areas that are closed, because it's a lot easier to get through. Some of those require some heavy logistics to get done. We're also doing sanitizing, spraying, electrostatic spraying. We're doing fogging. We're doing anything that we can do to give clients peace of mind, and we've done terminal cleans. So we've done a lot of the COVID confirmed cases. We've gone in as a team and totally gowned up and PPE head to toe and done top to bottom cleans. We've been doing that since, believe it or not, I think our first one was March 3rd, and we've done them every night since March 3rd, all over the state. So we're doing a lot more movement toward touch points, really concentrating on metal handles, chairs of arms, computer keyboards, touch screens, conference room tables, anything. But things are changing like every day. So what we were planning to do last week has already been thrown out. So we're literally changing our routines on a daily to weekly basis. And a lot of customers kept our full staff on for March to make sure we got everything ready. So when they reopen, they're going to be in really good shape, appearance-wise, and also in cleaning-wise. And then we're starting to lay the groundwork for the recurrence of this in the fall. There's a rumor that this will come back a little bit or a lot of bit, and to be ready for that. We've seen this before where added cleaning has made people more healthy at work, and then companies cut it because of cost. So it's always going to be a factor on that. And we're concerned about some of our clients. We did have some calls from fully open and operational facilities looking for 25 and 50% cuts. Fortunately, it's only one client, but kind of an awkward conversation when everyone's going the other way.
And just to make a comment on Jim's statements, there, like you said, things are changing daily. Our plans are changing and flexibility. And as businesses, I think we also need to remember as a society, we're very focused on the healthcare workers right now, and they are in the front lines. But, without Jim's team and other teams like them, we're all at risk. So I think one of the things we can do as businesses and as a society is remember that the support staff in the hospitals, the places won't run without them. The people who are in the trenches cleaning for us, those of you who are making things and distributing things are very crucial to what's going on now. And to just thank people, show that compassion and appreciation, and that goes a long way. So, I'd like to say thank you all for what you're doing above and beyond those healthcare workers who are in there dealing with sick patients. You allow the rest of the world to do their jobs.
Okay, we've got a couple more questions, but let's switch over to our audience and see if there's any questions that come in for our panel there. And if not, we have a couple more questions to fill in. So if anyone has any questions, could you please either chat room or Katie, tell them how you want those questions to come in.
Yep, it would be best if you guys could write in the chat. If not, you guys can unmute and try to ask them, but we'd prefer if you wrote in the chat. Thank you.
While we're waiting for any questions to come in, there's a question, Ruth, on lessons that we've seen from other parts of the world, from Asia and other parts of the world, in terms of prevention, disinfection, and are we as a country adopting the best practices? If not, what can be improved? I hope it's not a political question, but a scientific question.
Yeah, I think in large part we are following what we have learned from Asia. China, for example, has, as directed by their government, had a lot of direct communication to everybody, businesses, consumers alike, on what they needed to do from a cleaning and disinfection standpoint. Some of it was a little more extreme than what we would want to follow here and need to think about from a, frankly, human safety perspective. But we are taking the essence of those messages, that is, that there needs to be a concerted focus on cleaning and disinfection with the right kinds of products, to help stem the spread. I think the current evolving situation with masks is another one to watch. There were very strong requirements from the Chinese government in particular to mandate that anyone who was out in public, and obviously it was not many people, but those who had to travel for work or food shopping and so on, were absolutely required to wear a mask. And if they did not, they would be talked to. Will we get to that point? I don't know, but I think that's where there is evaluation of the epidemiology of did that really play a role in preventing the spread or not, is something that CDC and someone would be looking at.
Okay, thank you. We have a quick question here. Chlorine bleach seems to be the most EPA approved per the N list. Is bleach safe on all surfaces you use with a disposable wipe? And how long do we need bleach to dwell on surfaces to be effective on COVID-19?
For this, it is crucial that we follow the labeled directions for these products in order to ensure that the right concentration of bleach remains on the surface to be effective. And these times will vary based on the particular formula of the product. So following the label is crucial here. With higher concentrations and potentially with longer dwell times, there can be some damage from bleach on certain kinds of surfaces. So we need to be very careful and use these products as specified. Manufacturers of such chlorine-containing products do stability testing and surface testing before they release these products in order to ensure that there aren't any unintended sort of damage consequences from using these products, in their process of inactivating, contaminating microorganisms. So yeah, there's a lot of benefit to these products, but they have to be used appropriately, as there can be negatives that come along with them.
Next question is, when ordering takeout food, how concerned do we need to be about COVID virus being transmitted by our food preparers? I guess that's twofold, right, on the container and on the food.
Yeah, I'll answer this one quickly, and then I will apologize as I need to jump off this call to get to a different one. But I think, as has been stated, the message regarding what practices need to be in place has been communicated. And we have a lot of customers in the food service space who are continuing to operate and provide delivery and take out sort of food options. And we know that they are following these kinds of practices, practicing social distancing, washing their hands, making sure that any sick people are not working, et cetera. So some of it is assurance that these companies who, as has been stated, want to stay in business and want to do as much as they can to service their customers are going to be following the right practices and not taking chances with that. There is not evidence of transmission from food packaging in spread of this disease. So personally, I am not concerned about that as a transmission route for the organism.
So when a scientist tells you they're not concerned, that's a good answer. So thank you. I got an emergency call I got to take at 10, so I'm gonna have to hop off. So Jason, can you take over? And
I got it. Yes.
Hey,
thanks.
Jim and Ruth, I really appreciate you joining us, and wish you all the best.
Thank you. I appreciate being part of this. Take care, everyone.
Thank you.
Jim, Jeff Finkel here. Just real quick, I want to thank Jim for hosting and being the moderator, and you did a great job. Thank you very much, Jimmy, and Jason as well.
We have one more question from Neil. Have you heard that this might be a blood type virus, type A more likely and type O less likely? I don't know if you've seen that, Kathleen or Dana.
I have not. Can the caller expand a little on what they're asking?
I think maybe what he's asking is if you're more likely to get the virus if you're a specific blood type.
I have not seen any data to support that.
Okay. And then Phyllis is asking, should people working in offices be wearing masks?
I think that over the next few days, you're going to see new guidelines from the CDC, and that certainly is a possibility. But the big thing to remember is the social distancing. If you're working in an office, the 6 feet is what is most important as of today.
Okay. If does anybody else have any questions? If not, I'm gonna say thank you to our panelists, Kathleen and Dana and Joe. And I really appreciate everybody who's been on the line listening. If you have any further questions, we'll be sending an email out with the transcript and the information that you heard today. And you can respond to Hill and Marks, and we can get those questions out to the experts that were on this panel. But we really appreciate it, Kathleen and Dana and Jim and Ruth, and hope everybody has a great, safe, healthy day.
Thank you, Jason. I think this is excellent collaboration, and appreciate the opportunity to be part of this.
Thank you so much.
Thank you.
Thanks, everybody.
Bye, everybody.
Great job. Be safe.